everyone, my name is Vida Sandoval, and today I'll be telling you about my project exploring the potential impacts of a closed-loop referral system to address adverse childhood experiences in LA County. To start, I'd like to tell you a little bit about ACEs, which are traumatic or stressful events experienced before age 18. And ACEs have been shown to be associated with poor mental and physical health outcomes throughout the life course. Because of this, ACEs screening has really become a major public health focus in the past several years. However, as we see that there is this increase in ACEs screening throughout California, we see that there are really still some significant gaps in existing ACEs interventions, whether that's really lack of standardized and integrated responses once the ACEs are identified, or really having that follow-through responsibility solely on the patient instead of the clinician or the community-based organization providing those services. So the ACEs LA program is a screening and treatment program for ACEs, primarily in pediatric clinics in Los Angeles County, and they received a grant to create this ACEs LA trauma-informed network of care. And what this network of care is, it's basically linking clinicians who are conducting clinic-based ACEs screening to this robust network of vetted community-based organizations throughout LA County. And these CBOs are providing the social needs services to the patients and families once they are identified with an ACE. A really important component of the network of care is this closed loop referral system. And basically what this is it's 1 degree online platform where clinicians can log in into it during clinic. They find an appropriate community-based organization tailored to the family's identified ACE. And then they use that platform to refer patients to those CBOs. And something that's new that wasn't present before is that the CBOs can then give the clinicians feedback on whether the referral was received and if the patient was assigned to a resource or service. So given this information, my study really sought to explore CBO and clinician perspectives on one, their existing referral systems before implementation of the closed loop referral system, and then 2, the potential impacts of this closed loop referral system before its implementation. And how did I do this? Basically, I conducted 23 semi-structured interviews with both community-based organization staff and clinicians. I used semi-structured interviews that I conducted via Zoom and then coded all of the transcripts based on thematic content. So what did I find? Ultimately, I found that there were shared themes of barriers for both the CBOs and the clinicians. There were referral inefficiencies in their current processes, staffing and capacity challenges, follow-up challenges when contacting patients, communication barriers between the CBO and the clinician, and then also general lack of knowledge about what services the CBOs provided from the clinician perspective, which also affected the CBOs themselves. From the patient and family perspective, we saw that there was a lot of navigation burden on the patient and family themselves. There were communication barriers with CBOs and clinicians, and then again, this referral inefficiencies present. Then when we asked about the closed loop referral system and its potential impacts, we found that there were 5 major potential positive impacts: improved communication, more successful connections between the patient and the community-based organization, improved patient-centered care, so no more of this follow-through onus on the patient, more of the responsibility on the clinicians and the CBOs, more efficient referral processes, and overall increased awareness of CBO services. However, some challenges were still present. So for example, clinicians and CBOs were concerned about the referral platform itself and its user friendliness. And then they were also concerned about capacity. Will this system add more of a workload to providers and CBOs who already have a pretty hectic workload? Ultimately, they had some recommendations, ways to decrease CBO and clinician burden, whether that was platform integration within the electronic medical record or a designated referral person or team, continued communication and collaboration within the network of care, improved education about what services the CBOs provide, and overall upgraded referral platform features. So in conclusion, given the lack of standardization in the existing referral processes and the fragmented social service landscape that we discovered through these interviews, we believe that the network of care closed loop referral system presents a really standardized and centralized model that may ease the burden for many patients and families who currently navigate the complex referral system with little support. Moving forward, the NOC staff should focus on ways to decrease CBO staff and clinician burden to allow for more successful implementation of this new referral system. Thank you to all of my mentors and program and leadership that allowed me to complete this project successfully.